Hi everyone, this is Dr. Krupan Kumar, General Physician working at TX Hospitals, Kachiguda. Today I just want to highlight some of the few points regarding dengue fever. So what is dengue fever? What are the complications associated? How can it be treated? So these are the topics I just want to highlight. So coming to the etiological factors, what is dengue? It is a kind of fever which is attacked by Aedes mosquito. When such mosquitoes is bitten to a human, the virus transports to the bloodstream, and this mosquito is mostly takes its most bite in the mornings than in the nights. So these mosquitoes are more prevalent on morning times. So once this mosquito transfers the virus to the body, it goes into the bloodstream and causes different kind of complications associated. So main clinical factors, means clinical symptoms, what we see in dengue fever is like first point is fever. Fever will be very high grade. It will be around 102 degrees. So the high grade fever with periorbital pain, chills, abdominal pain, and sometimes itching and skin rashes. So these are the symptoms we see mostly in dengue fever. So high grade fever and itching, rashes, and sometimes nausea, vomitings also are observed. So this kind of and lethargic feeling, very weak feeling. So generalized weakness. These are the symptoms we see mostly in patients. So once the patient has come to outpatient block and tells you, and he comes across these symptoms, we advise for a diagnostic test. So these diagnostic tests include dengue NS1, ELISA, and complete the picture. So these are the things where we can diagnose patient is having dengue fever or not. So coming to dengue NS1, it has IgG, IgM portfolio profiles, and this dengue NS1, if it is positive, then patient is diagnosed as dengue positive. And ELISA test also is a main contribution towards dengue. And one more thing is complete blood picture. Normal complete blood picture, in that we see a scenario of PCV, which should be around 40 to 50. If it is less than 40, then patient may have PCV less than 40 and platelets less than 1 lakh, or in a decreasing trend, then we call it as dengue fever. So these kind of patients can be managed in outpatient block with as they have come with fever, they can be given with some antipyretics and antibiotics, and plenty of water. Water plays a main role in dengue fever. So patient diagnosed as dengue, he has to take around 4 to 5 liters of water per day. So this increases the platelet count and metabolism. So what I want to tell you is, patient having this kind of symptoms, all dengue patients may not be admitted, may not be treated aggressively. There are stages for dengue fever. Patient coming with high fever and all, if it is manageable, you can give some prescription in the outpatient department and you can send home. If patient's fever is coming down, his weakness is coming down, periorbital pain is coming down, and nothing like itching or rashes are there, then he can be treated at home with this kind of medications. But some patients land up in complications also, like dengue hemorrhagic fever and dengue shock syndrome. So what is dengue hemorrhagic fever is, such patients will be coming to hospital with high grade fever, and platelets will be around less than 1 lakh, and there are bleeding tendencies. Once platelets are decreased, patient will be having bleeding in the body. So bleeding may be from nose, bleeding may be from the gums, bleeding may be in the stool. So these are the points where patient has to be admitted and treated aggressively. So such patients may get complicated also, and they should be admitted in only intensive care and treated appropriately. So for this kind of patients, we have a different kind of treatment, and we continue with that. And what is dengue shock syndrome is, patient having, this is the severity which we grade as the highest severity in dengue fever. So in this kind of patient comes to hospital in a shock state. What is shock state is, like patient will be, his blood pressure will be completely not recordable. He'll be semi-conscious or unconscious. So these are the like complicated problems which we see in dengue. So this kind of patients should be admitted in intensive care, and proper high-end treatment with high antibiotics, and sometimes blood transfusion is also required for this kind of patients. So what kind of blood transfusion depends on the platelet count, bleeding tendency, and fever. So there are different kinds of blood transfusions according to the severity of the patient. We advise the treatment. So if patient having less than 10,000 platelet count only, we generally go for blood transfusion. So depending on the severity, we give single donor platelet, which we collect from other person, and we donate it to the deceased. So this single donor platelet is definitely very useful in such patients, and it increases the platelet value. Once platelet value is increased, bleeding tendency decreases and patient improves. So there are some strategies where we have to follow for blood transfusion. We can't give blood transfusion to every patient who is positive. So the criteria which includes transfusion is platelets less than 10,000 or 15,000. So or the other option is patient having heavy bleeding from nose or bleeding from gums and anywhere in the bleeding tendency, they can also be given transfusion. Not that patient should be waiting for 10,000, 15,000 of platelet count. That is a different category. But once patient is having decreased platelet count or not, patient having bleeding tendency anywhere in the body, they should be highly and emergency in an emergency were treated with transfusion also. So these are the things which I just want to highlight regarding dengue fever. Thank you.